What fires you up about what you do?
Well, I have a couple things. Number one, the field of rheumatology fires me up because it is, when I first came into rheumatology in the early 90s, there wasn't, people, in fact, my colleagues said, why are you going into rheumatology? You really can't do anything for those patients. Well, in the time that I've been a rheumatologist, we now have phenomenal treatments for rheumatoid arthritis, for, lupus. We have treatments for osteoporosis. These were all things that made patients, their quality of life just went down, and they died early too because of these devastating diseases. But the other thing that fires me up is this whole concept of being an activated physician and trying to defend the profession of medicine, because I actually believe that when what is good for physicians is good for patients. The two, they're kind of intertwined. That's a bond. It's unbreakable. And all that. And so if we're focusing on the profession, i.e., more time with our patients and all the things we've kind of talked about today, then, so I'm advocating for that. It's sort of like, this is what I tell my doctor colleagues all the time. You have the knowledge, skill, and experience. You have everything that it takes to reclaim medicine. And that's what we need to do as a profession. Put it back into our hands and work with pharmacies too. That's the other thing. I remember the day my father working with the pharmacists and getting the patients everything that they needed, and particularly independent pharmacies that are not necessarily corporatized. I'd like to see a reversal of all that. And I'm just one person, but I try to get, that's why I'm so thankful to have come on your show, and thank you for having me, because I think it's a message I want patients and physicians to hear.